Okay, I think we're going to start. If you could all kindly sit down and we'll get going. So, good afternoon. It's just a couple of minutes afternoon. So, welcome to this session on ICT-based innovations. My name is Pascal BIJLEVELD. And I'm the CEO of ATScale, the global partnership for assistive technology. And it's my honor and pleasure to be chairing today's session. It's really great to be here. It's my third year at the Zero conference. And it's just so great to see partners again, friends, colleagues. And I always find it such an inspiration to come here and really a source of hope, which I think we all need today, given some of the things that are going on in our world that we couldn't imagine actually happening a month ago. So very glad to see that still we have here a lot of energy. Today, we're going to be really having, I think, an exciting and very concrete conversation about solutions. And I'm very glad to have with me on the panel innovators that you'll be hearing from. We have Iván and Nagore from ONCE and Samsung, who will be talking to us about a tool they've developed to facilitate employment for persons with disabilities. Lola, Gielen from Happybots will talk about her social robots. Jussi, Kujanpää from Quha, we'll talk about a mouse that he has developed that can be controlled through head movements, if I understood right. Yes. And Arun, sitting next to me from Blink Foundation, will talk about an e-learners platform for persons with dyslexia. So 4 different innovations, all very impactful. Before we hear from them, I will just slightly abuse of my position as chair to just say a few words about a related project that we've been working with, which I think is very relevant to today's conversation. Some of you may have heard me and other colleagues speak last year. We had a panel with Google and GDI Hub, a close partner of ours, on smartphones as assistive technology. We presented some early findings from a study that we're doing, looking at really the positive impact of smartphones for persons with visual or hearing impairments. And now that study has come to its fruition, and we've got, I think, very convincing evidence and use cases of how much positive impact smartphones can have. And this study was done in Kenya, India, and Brazil with close to 1,000 participants. And why is it so important? Why is it relevant today? Is I think smartphone, just like digital platforms, is a key medium for a lot of the ICT-based solutions and a key way to really democratize their access and really scale very rapidly. Of course, access to smartphones themselves remains an issue and a barrier for many persons with disabilities, in particular in low and middle income countries. And so we need to step up both from a government perspective, but also from the private sector to change that. And the study that we're just concluding will hopefully help, advocate for change in this space. And we'll be continuing to work with Google and GDI Hub and anybody else in this room or in this conference that's interested to partner with us to drive that change forward. So that was a little plug for smartphones as ATS and also, of course, an ICT-based innovation. But now I'm really glad to turn the floor to the panelists. They will each have 8 minutes and they'll present their innovation in those 8 minutes. And then we will have the opportunity to have a discussion and a conversation. And you'll have the opportunity to ask questions to all of them. So without further ado, I will turn to first Iván and Nagore. They will be showing a video that is in Spanish, and you can use, if you have your earphones, on channel 2 There is a translation, and there will also be captioning in the video. So, with that, hopefully technology will be with us. I'm always worried with videos.
No, the video is at the
It's there? Okay, go ahead.
So, no, the video is...
27,8% de las personas con discapacidad en edad laboral están...
Can we pause the video? Thank you.
Here's the presentation. Yeah. So, good afternoon. We are Iván Carmona from Fundación 11.
And Nagore Bilbao from Samsung Electronics Iberia.
I'm a 43-year white man. I have short black hair and light beard, and I'm dressing in blue.
And I'm a 41 white woman with brown hair, and I'm wearing a brown jacket.
We are from Spain, and it's a pleasure to be here in Zero Project to present our application IHO, Assistant and Guidance Tool. But firstly, let us introduce our organizations. Fundación 11 is part of the 11 social group, which currently employs 75,000 people, making it the fourth largest non-public employer in Spain. Of these employees, 44% are women and 60% are persons with disabilities, which means 45,000 employees with disabilities, making it the largest employer of persons with disabilities in Spain, and I could say also in the world.
Yes, and well, Samsung, you know, is well known for our cutting-edge technology and devices such as smartphones or smart TVs. But maybe you won't know that we have a strong commitment to enhancing people's quality of life, breaking barriers through our technology. This is why 12 years ago, we launched a local program called Technology with Purpose. During these years, we have developed more than 30 projects, invested more than 25 million euros, and impacted more than 500,000 people. Technology with Purpose has 4 key pillars, which are education, culture, accessibility, and employability. And furthermore, we've been collaborating with Fundación 11 since 2017, and IHO is one of these projects with purpose falling into the accessibility and employability pillars.
So we are going to present you the application IHO, which stands for Assistant and Guidance Tool. It's a project that we have developed in collaboration with Samsung and the Spanish Association of Supported Employment. It's a technological tool that aims to facilitate the employment for persons with disabilities under the supported employment formula and their training, pre-employment training. It's an accessible multi-platform application with web access from any browser and with iOS and Android native applications for phones and tablets. Its potential users are therefore both workers with disabilities, especially those with more support needs, like those with intellectual or psychosocial disabilities. They're trainers and job coaches in the entities, and the natural supports in the companies where they are hired. IHO incorporates the everyday use of technology. On one hand, it offers cross-cutting pre-employment training, very useful for jobs in many sectors, and on the other hand, it facilitates task completion with step-by-step instructions on how to perform them. All of this to increase the motivation and the autonomy of the workers, and for trainers, job coaches, and natural supports, it facilitates communication and management in the supported employment process.
Yes. Now I will be talking about the features of IHO. Starting with pre-employment trainers, they will find versatile and interactive content. Currently we have 2 courses, one about the health and safety in the workplace, and the second one about communication skills and customer service. Beyond this, this application, IHO, is also useful for job coaches and natural supports in the workplace because they can describe tasks step by step, either using text or images or videos. They can also plan the agenda, program alarms, they can assign tasks. In addition, they can also follow up the employee satisfaction, and they can also track the performance of the employee through questionnaires. But above all, IHO is useful for employees with disabilities, because with this user-friendly application, they can take courses prior to starting work. They can also follow step-by-step instructions of new tasks. They can know what tasks to complete at all times, and they can also communicate with their job coaches and their natural supports in the workplace, when they have already finished the task or they are encountering any obstacle.
We have developed this project under user-centered design methodology, placing the end users at the center of the entire development process from the very beginning and throughout all phases. This approach to ensure that what we have developed met the user's needs and preferences and requirements. To do that, the involvement of the disability organizations working in supported employment was crucial, and more than 100 entities responded to an online questionnaire, and 30 entities participated throughout the entire development process, from the needs assessment, the user testing, and five-month pilot phase, using the application in real environment with their workers, support, trainers, and job coaches. And finally, about the IHO community, we are currently 150 disability organizations and service providers using IHO, with more than 750 users registered. We launched the application in May 2024, which is free for disability organizations and service providers in Spain. We already presented the project at the World and European Supported Employment conferences, and we are preparing a pilot in Latin America. Also, we are considering new usage contexts beyond training and employment. And in last year, we carried out communication campaign targeting employers, and that's the video that we would like to show you to finish our presentation.
El 27,8% de las personas con discapacidad en edad laboral está trabajando en la actualidad. Seguramente pensarás que en tu empresa se debe trabajar con autonomía, se deben tomar decisiones, se debe ser independiente. Y seguramente pensarás también que Sergio o cualquier persona con discapacidad no es capaz de hacerlo. Pero tenemos algo que decirte. Siempre necesitamos el apoyo de un equipo, tengamos discapacidad o no. Por eso hemos querido hacer la primera foto de currículum en equipo. Porque cuando contratas a alguien, contratas también a todas las personas que le apoyan.
Cuando Sergio entró en la empresa, pude ver que su incorporación fue muy sencilla y eso me ayudó a quitar cualquier prejuicio que pudiera tener hacia personas con discapacidad.
El empleo con apoyo ha hecho que Gielen sea una más en la empresa y gracias a las nuevas tecnologías la adaptación ha sido mucho más sencilla.
Para trabajar con mayor autonomía en cualquier empresa, Verónica tiene IHO, una aplicación que sirve de apoyo para personas con discapacidad.
Fundación 11 y Samsung presentan IHO, una herramienta creada para ayudar a personas con discapacidad a formarse y trabajar con mayor autonomía. Porque trabajar con autonomía es hacerlo con la seguridad de tener detrás el apoyo necesario. Infórmate sobre cómo IHO puede transformar tu empresa en talentosinlimites.es.
Thank you so much for that. It's a great example, and also a great example of the partnership and what we can do with that. So now let's turn to Lola from Happybots.
Hi, my name is Lola Gielen. I'm a 32-year-old white woman. I'm wearing glasses and I have brown hair. And I want to take you on a little journey to a typical Dutch classroom. There are about 30 students, they're working on a task, when suddenly one of the students freaks out, topples over their chair and starts screaming, and he's really angry. And the teacher doesn't really know what happened, tries to calm him down. It takes quite a while. After maybe 10-15 minutes, situation is back under control. She tries to pick up the lesson again. And then after a while, she asks another student a question, but the student kind of goes really silent, runs out the classroom, and bursts out in tears. Again, the teacher tries to connect, tries to figure out what is wrong, and it takes another 10-15 minutes before she can pick up her class again. More and more kids that have trouble expressing their emotions end up in regular education in the Netherlands, but this is also true in special education. And we want to support these kids and these teachers in being able to communicate in a way that they don't have to either explode or implode when their emotions boil over. And to do this, we made a device that is called Felix. He's a little robot. When you turn him, he shows emotions by the color of light he shows and the eyes. So I'll try to describe this as good as possible. He is kind of egg-shaped, and you can tell Felix how you feel by turning him and choosing one of the emotions that he shows. So I'm now turning him, and he's changing colors, and the eye shapes are changing. If you think this is how I feel, he is now blue, he has sad eyes, you can press him, he gives you a little wink, and this is also the moment that he, which one is next slide? Yes, that he sends off this information to our online platform. The thing we do with Felix is kind of twofold. It is the in-the-moment communication, so in the classroom when the student turns Felix, the teacher can see this student is angry or sad. They have made some agreements beforehand how to handle these situations. So maybe when the student is angry, they will go out of the classroom, take a breather. The teacher can see that they are angry, and they will be back in a few minutes when they had the chance to calm down. The other thing is we have an online platform with a Google Calendar-esque interface where you can see all the emotions, kind of like your appointments, but instead of appointments, it's all the feelings that you have put in during the day. We also have a little bit of data analysis where you can do pattern recognition. So for instance, if somebody has a bad day on every Thursday of the month, you can look into that and see, is there something we can do about these Thursdays to make them feel better? So Felix is used as a co-worker kind of, or assistant for the teacher, or a caregiver that helps the Felix user. And Felix is a buddy for the user. So for the child in this classroom, he's emotional support. I wanted to show you this little example of a note one of our users made. She's a little girl in a special education in the Netherlands, and she made this little drawing of Felix and the different emotions that Felix displays. And on the back she wrote, "Mom, this can be useful at home so I can express to you how I'm feeling." And this is really why we do this, because this really tugged on our heartstrings, and we want to reach more little girls like this and make them able to express how they feel, and little boys and big boys. And in the Netherlands we have about 250 robots active. They can reach multiple users, so I think about 500 people that have now used Felix, and we would like to expand this, hopefully globally, to reach more people and have more impact, especially. So if you have a healthcare institution or a school, or you have a foundation that helps people that have these kind of issues, we love to come in contact to do some projects and see if it would work in your environment. We're also, because we are a small company, we're only 2 at the moment, in order to make this scale up possible, are obviously looking for funding as well. So if you have some ideas on how to fund these projects, that would be lovely as well. I would like to meet you after this presentation. Wow, I went really fast. I have time left over. Yeah, I can either wrap up or people can ask me a question.
Let's save the questions for
Yeah,
afterwards.
okay.
But thank you very much. That was really, really interesting. A big round of applause. Really, really interesting. Let's now turn to Jussi to talk about his mouse.
Okay, hello everyone. My name is Jussi Kujanpää, and I'm the founder and managing director of Quha, a Finnish company specialized in assistive technology. And it's an honor to be here today at the Zero Project Conference to present our latest innovation, Quha Sono X mouse. So Quha was founded in 2012 to develop better communication tools for people with severe disabilities. We wanted to create a computer mouse that could be used even by individuals with severe physical limitations. To achieve this, we selected a gyroscope as the core sensor technology. And in 2013, we launched the world's first assistive gyroscopic mouse. On screen, you can see a close-up of a woman wearing the first version of the Quha Sono mouse. So, the core of Quha Sono devices is a gyroscope which tracks head movements and translates them into real-time intuitive cursor control. Unlike many other solutions, gyroscopes offer high precision, versatility, and reliability in various environments. Based on years of user feedback, we developed Quha Sono X, offering compact and lightweight for user comfort, universal Bluetooth connection, ensuring compatibility with all modern devices, computers, tablets, and smartphones. Easy magnetic attachment for different wearing options, and magnetic charging dock for easy charging. The image shows a woman using the Quha Sono head mouse to control her computer with head movements. In addition to its core functionality, Quha Sono X introduces several innovative features. Hands-free gesture control for common mouse functions like scrolling and pausing. Multi-device connectivity, allowing users to switch between their devices easily. Tremor filter, which helps users with involuntary head movements maintaining accuracy. Adjustable sensitivity settings for both horizontal and vertical movements to enhance customization. Quha Sono X also includes Quha Duel 2 software for easy hands-free clicking. Here you see a close-up of Quha Sono X head mouse with an ear clip attachment, one of the many ways to wear the device. So several camera-based solutions exist, such as eye gaze and head tracking. But Quha Sono X offers some unique advantages. Works with all modern devices, all computers, tablets and smartphones. It is not affected by lighting conditions, unlike eye gaze and camera tracking. Easy to learn to use and requiring minimal setup. Pixel perfect precision, enabling smooth and controlled cursor movement. And it's more comfortable than eye gaze for long periods. And of course there are some limitations. It requires wearing the mouse, but it's lightweight. It's charging, but it's optimized for daily use and requires some head movement, unlike eye gaze. So technology should empower people, and Quha X has just done that. Increase independence, users can control their devices without assistance. Enhance accessibility, opens doors to education, employment, and digital equity. Positive psychological impact gives user greater control and confidence, supports caregivers, reduces the need for external assistance, and contribution to digital equity ensures that everyone has access to modern technology. On screen, you see Veli Tarvainen, a graphic designer paralyzed in a car accident, able to continue his career today thanks to Quha mouse. So rather than just telling you about the impact of Quha X, I want to show you a real example.
My name is Jari Mönkkönen and I am a tetraplegic. I am a former firefighter. I've been working there for 12 years and I have also a long career in artistic gymnastics. I have 29 gold medal in Finnish championships and I also have a silver medal in European championships on high bar in '98. This tetraplegia is caused by a sports accident. I made a double backflip and I landed on my neck. Nowadays, I'm working as a head coach in a company called Voltimedia. We are training young people and sports clubs. I just published a book called Viimeinen Voltti, Last Flip, and it tells about my life before and after accident. Computers are very important in my daily life. After this accident in rehabilitation center, I've tried several different devices and I chose Quha head mouse. I'm using computer and Quha head mouse for taking pictures and social media. Quha head mouse is accurate, fast, lightweight and easy to use. It is very important that I can use computer and camera by myself.
Okay. So, we are excited about the future and committed to continuous innovation. Our next steps include further improving our products based on user feedback, expanding global availability to reach more individuals in need, strengthening partnerships with caregivers, healthcare professionals and accessibility organizations, and exploring new features and solutions to further enhance usability and independence. So Quha's mission is simple. Technology should adapt to the user, not the other way around. Thank you for your time. I would love to discuss collaborations or answer any questions. Thank you.
Thank you so much for that great presentation and that amazing innovation. Last but not least, and by the way, I should have mentioned that all of the presenters today are also Zero Project Awardees. So now we'll hear from Arun, about his innovation, and then we'll open up the floor for questions.
So, good afternoon. The first question I want to ask you all is, am I looking disabled? Someone answer? No? So that is a lifelong journey of proving myself being a disabled, because I am a dyslexic individual having difficulty in reading, writing. So why D-learners is different learners. So we are all different learners. We, just to kind of go iterate my own life, I changed 7 different schools to complete my schooling. And every school in July, I'll be a very popular student because I was an athlete and I used to kind of win all the running games. But after August, I become a very invisible student. Why? Because my marks would be having the most valuable number. What is the valuable number? 0. So that would be the number in all my mark sheets, so which I become invisible after that. So the school will be very motivated to take me out of this system in the end of the year. Why? Because they are worried about their overall pass percentage of the school. So this was a journey, 7 years of every year of my schooling. And finally, one principal actually asked me to go to a medical setting, which is basically a mental hospital back home in India. So that medical setting was even more demeaning myself. Why? Because I started feeling, why should I be here? Why am I? Is anything wrong with me? And am I having any mental retardation or something like that? Because you need to consider my age. I was 13 at that time. So that was the beginning point of D-learners, wherein we wanted to create an accessible environment for the child to be empowered within the school itself or within the house itself, but without changing schools or getting into a medical setting to be diagnosed. So how that works. So we focus on kids having dyslexia, dysgraphia, dyscalculia, and ESL, English to be second language. Why can't we have an SaaS platform to connect all of these stakeholders like parents, teachers, special educators, from sensitization of this difficulty to the intervention? So this is not a small problem. It's about 1 in 5 children, school-going children, regular school-going children are having this problem. So if there is stigma attached to it, parental denial, definitely yes. Because proving me having a disability itself is a first problem. And the next problem is others accepting me as having this difficulty is the next problem. So there's a lot of parental denial and stigma, access and affordability. Access, why is it difficult? Why? Because I was going to school and after coming home, I used to travel 20 kilometers away from my house to go to access a special educator to get remedial help. This is in the city, but the same thing, it goes to a rural area. But all the caregivers who can actually are equipped for remedial education are only in the metropolitan cities. So connecting, next slide. Yeah. So this whole ecosystem, how are we connecting? So I have a small video to share it to you. Play. Yeah. So as when it is playing, so this whole ecosystem, if only there is a system to connect all of them into a same system, same ecosystem wherein a child can access remedial care, access screening, access intervention in their own houses or in their own schools rather than going to medical setting. If that is working, how different it would be. So presently we have reached about, on reaching our 10 plus 100 schools, we trained about 3,000 teachers and we have actually screened more than 17,000 children and 4,335 students are in the platform using our assistive tech from awareness sensitization, screening and intervention. So I have also sent a separate video file if that is not working. Is it not there? So here the whole environment is what we have built is for screening, awareness, sensitization, and intervention, mapping the parent, teacher, and a special educator in an environment where the child is accepted and celebrated in their own lives. And the point here is all this is powered by an AI tool to measure the progress of the child and make more improvements and more syllabus changes for these remedial tutoring systems. So this particular thing is not a problem only for India. It is actually a problem in every country in the world. Why? Because special educators are sitting in metropolitan places, but the children are everywhere. And if these kind of systems would be in every country, definitely these children will be given the right remedial intervention in the right time and also given the right help, what they really deserve of. Why? Because no one is signing up to be getting into a system wherein they are getting self-doubt or self-questioned when a child is 8 years and 13 years old. Why can't we actually have an environment to nurture the child rather than increasing the self-doubt of the child? Thank you.
Are we still going to get the video or not?
I hope so, sometime. Or I can share the video and later after the questions we can play it or something.
Yes, if we can get it to work later, we can show it later. Great, so thank you so much for that presentation. So I think you've heard now from these 4 really amazing innovators and innovations, and I'm sure you have questions to them. I'm going to open up the floor to the gentleman here in front of me.
Thank you to all of the speakers for the great presentation. My question is for Mr. Carmona and Mrs. Bilbao. Thank you for the amazing project. In terms of the process of creating this solution and this application, I'm thinking of what lessons can we learn from this process of collaboration that led to the creation of this app. So connecting with the previous talk, for example, that was about assistance of disabled people in humanitarian crisis. If there were solutions to be developed in other contexts such as that or others, how do you make sure that you include the needs and the perspectives of stakeholders like companies or users with disability so that the application actually meets their needs? And it's a double-fold question. When is an application, when is a mobile app the solution, and when is that only part of a broader system or a broader solution? Because creating an app is the first thing we may think of, but when is it the solution and when part of a larger system? Thank you.
As I said, the project was developed under a user-centered design methodology. We involve the entities working with people with disabilities from the very beginning throughout all phases to co-design with them the solution to ensure that the needs, preferences, and requirements from all the actors of the ecosystem of the supported employment were included in the project. No? To do that, we carried out in-depth interviews, focus groups with the entities, with the trainers, with the job coaches, with the workers with disabilities, to the assessment, the needs assessment. Then we also involved them during the testing evaluation activities. We did three iterations of testing, and in the end we carried out a 5-month pilot phase with the real users using the application in real environment, with the job coaches, the trainers, and in the entities and the workers, to ensure that using the application in the real life was that met the needs and preferences. Do you want to? And regarding the second question was
when is an application the solution, and when should it be part of
Yeah.
a larger system or solution?
Yeah, it's now it's the solution. It's technological tool available from any browser and website, and also with applications in iOS and Android phones and tablets. So it's available from any device, we could say. This way, both workers with disabilities, depending on the position, if it's imagine in office or if they need to use in the mobile phone or whatever, but also the job coaches and trainers, for the follow-up, they could do it in transit, for example. They don't need to do it at the office, they can do it at any place. So, yeah.
Thank you. Any other questions from the floor? Yes, please.
Yeah, quick question for Iván and Nagore. Congratulations to the other presenters. I think it's a fantastic project. Quick one. Have you guys analyzed any kind of results with the application and without the application, or with the app and the supported or the support professional and without?
As we said, we launched the application in May, so we are still in the process that entities are starting to use in the application. We have like special cases where the entities have told us that the application has made the workers carry out their activity with more autonomy, they are more motivated, and in many cases they don't need to contact the job coach at any time, because they can go to the app, see what they have to do, when they have to do it, how they have to do it, so they can be more autonomous. That make them more motivated, more confident. So we don't still have data to compare with and without. We need more time, more users. But that's a point that we want to analyze, because it's needed to say, yeah, it's a perfect solution. So.
Thank you. Yes, gentleman in the back there.
Yes, hello. My name is Jakob. I'm from Estonia. A question to Happybots. Do you have any good examples or stories on how have children and teachers in the school reacted to that?
Welcome to learners.
Hello. Because it sounds a fantastic idea, and I'd really like to, do you have any little stories from children who have used this already, and then what do they feel like? Thank you.
Yes, loads. We have about 250 users in the Netherlands, and a large part of that is in education. For example, there is a class with a lot of gifted kids, where there's also kids with autism, and they had a lot of escalations and unexplainable, unexplained behavior, and they gave a few specific kids that had the most issues with expressing their emotions a Felix, and after a few months they came back to us to tell us that not only did these kids get more insight in their own emotions, it also significantly reduced the amount of escalations in the classroom, and it was altogether more nicer environment for also the other kids in the classroom. Another great example is that a kid that in special education that was using Felix, the teacher told us that not only was it useful communication between them and the kid, it was also attracting attention from the other students that were reacting to the emotions of the Felix user. So when this child was sad, his buddy next to him would comfort him, whereas before they wouldn't know because he was very closed off. Yeah. Thank you.
Thank you so much. We're going to take one more question from the lady there, and then we'll show quickly the movie that we didn't see before.
Currently, the application is only in Spanish. That's why we are preparing a pilot in Colombia as first country, but with the idea to extend it to other countries. Firstly, maybe in Latin America because of the facility of the language, but the tool is ready to be translated into other languages. Of course, maybe we will need some funds to do it, but for sure in the future we are open to collaborations to scale it to other countries, yes.
Maybe before we turn to the video, just a quick question to the other three panelists along the similar lines, and here I'm again using this from a perspective of our area of work at ATScale, which is focusing on lower and middle income countries, and I'd love to just hear from you how you're thinking about possible use cases and expansion, in lower middle income countries where sometimes affordability becomes a much bigger issue than in some of the countries here in Europe, for example.
Well, yeah, it's definitely something we are considering. At the moment, because we have such small numbers, the cost price is still quite high, so we would like to scale up to reduce the cost price, and then once we get to a point where it's a bit more affordable, we are thinking of either sliding scale pricing or maybe buy one, give one. We still have to make a decision on which model would work best, but we would definitely like to expand into lower income countries as well. And we met some wonderful people here, so we, in the meantime, while this is not available yet, are thinking about maybe trying with some older models to do some little trials in lower income areas.
Thank you.
So, unlike the camera-based solutions, Quha does not require any high-end computers, but it can be used with a very low-cost devices like mobile phones and tablets. It's a wireless, lightweight, and it can be used anywhere, in schools, in homes, in rehabilitation centers. It doesn't require any stable lighting conditions or anything. And we also aim to establish local distribution centers or local partners to reduce the costs when it comes to, for example, importing the devices in that area.
And how much is the cost right now of a unit?
In Austria, our reseller is selling it for 1,000 euros.
In our case, this is basically this whole approach for paying the teacher should be subsidized. So we are a hybrid organization wherein we are also a non-profit. So Microsoft is actually supporting the intervention part of it. The screening is altogether free for everyone to actually, every parent to do. But when it comes to school and kind of give intervention and using the platform with the teacher, there should be organizations under their CSR, they will fund us and they will we kind of implement it. So we have done implementation in that kind of a model. It's about 75 schools in rural India. We have actually done that. And which will be a subsidized rate in comparison to a product which is acquired by a direct parent.
Thank you. So interesting just to hear different models of how these innovations can be made more accessible and available in lower income settings. So thank you for those responses. Maybe now we'll just give the chance to look at the movie from eLearners before we wrap up.
Yes, I hope that this time it works.
Welcome to D-Learners, where one belongs, enjoys and learns. If you are a teacher, we help identify the different learners in your class. If you are a parent, we help your struggling child learn better. If you are an enabler, we give you wings to positively impact more and more different learners. Our identification and intervention process includes a comprehensive screening report that identifies academic gaps and skill deficiencies responsible for academic challenges, blended sessions in online, personalized formats with digital tools to make learning interactive and fun, immersive online games utilizing cutting-edge technology to facilitate learning through play, self-directed live worksheets assigned during sessions to allow learners to correct and retry activities, boosting confidence and proficiency, physical worksheets in the D-Learner's fundamental and basic workbooks with over 200 pages of engaging activities, puzzles, and coloring sheets tailored to the child's level. Learning kit comprising exciting tools to make learning an effortless experience while also boosting the child's awareness and self-esteem. Graded reading to track your child's improvement in reading and writing fluency through periodic graded and norm-referenced tools. Individual student observation report based on initial reports containing responses from teachers, parents, or students, offering valuable insights into the student's learning experience. Parents Circle, where parents can be a part of a community where they are heard, understood, and can learn the best ways to nurture their children. D-Learners celebrates different learners, making remedial education fun, accessible, and affordable.
And I think we're going to have to wrap it up. But thank you so much for the panelists and for your presentations and for the participation of all of you here in the audience. One more round of applause, please. Thank you.